Welcome to Saxton on the Pod. Today we're excited to welcome on Jenny Carr, the force behind Intermountain Pilates Training Center. With a passion for Pilates that extends beyond the studio, Jenny's expertise spans from guiding middle-aged men and women on their wellness journey to fine-tuning the performance of professional athletes. As a highly respected Pilates instructor and trainer, Jenny's dedication to her craft shines through in her holistic approach to fitness and well-being. Join us as we dive into Jenny's journey from her beginnings in Pilates to becoming a sought-after expert in the world of Pilates. All right, Jenny, thanks for coming in.
Yeah.
We're pumped to have you.
Thanks for having me.
Do you know what our secret nickname is for you? The Witch Doctor.
I mean,
it was born so
I'll call that my
that with me, Kate, and Taylor, because the Braziers have the knee problems, and Taylor came in one time, or I don't know if you remember, one or two times.
Yeah.
No knee pain. It's been 2 years and zero knee pain now. So for anybody listening, if you have knee pain, go see Jenny.
Witch Doctor, the magic healer.
Mm-hmm. Yeah, according to some people and their phones.
So for everyone listening, people hear Pilates and I think they just think yoga.
Yeah.
Give us your definite, what is Pilates from your perspective? Explain it to everyone.
Okay. So I think that Pilates can be a lot of different things, and there are different modalities, and people can use it for fitness, or people can use it for biomechanics. But one of the things, at least for me with Pilates, is it's not really about yoga, which is more about lengthening or stretching or static stretching. But Pilates for me has been a path for me to help people heal using, biomechanics. My background's in physiology and anatomy, so I used that from my university and then kind of add a Pilates to it. And there's so much to it, right? We can use equipment. We really utilize a lot of spring tension, the pre-tension and recoil, and the way that the joints kind of absorb those forces is really different than using tubing or bands or weights, dumbbells. So we can really utilize the spring tension to really work the muscles as far as they can lengthen and shorten. So with what I do, adding a lot of length under load with the spring tension really helps people get into some good ranges of motion, but under load. So it's not just so static. And so Pilates for me has been something that we've been able to use at my studio to really help people heal, do a lot of post-operative, rehab and sports performance. And it's definitely not stretching, and it's a lot of strengthening, both eccentric and concentrically. And then, there's a lot of fascial stuff that we integrate into that as well. So it's very complex, and it can be a fitness class if somebody reads, it can be more fitness driven, which is great. But for me, what I use it for is Pilates is definitely, to stay healthy, to stay better at your sport, or better, even your sport is hiking or biking or skiing or whatever it is. We really utilize that so people can be better at it.
Yeah. And healing. Like it seems like there's a portion of PT in it almost.
Mm-hmm. Without question.
Yeah.
What you do is so much more than just Pilates. And obviously we could spend 3 hours with you explaining what Pilates is, right?
Yeah.
You probably get the question, isn't yoga just Pilates?
Right.
Like all the time. That's probably a common question that comes across. But you do so much more than Pilates with the athletes and the people that you work with, right? But let's, for at least a portion of this, focus just on Pilates. Then we want to get into your journey of all the healing and everything else that goes along with Pilates. So I did a little research about the history of Pilates because I've trained with you. But for the listeners, can you where did Pilates come from? Where was it born from? I know there's several different types of Pilates, some that you possibly don't agree with, right? And the one you specifically do. Can you take us through that journey of the history of Pilates?
Yeah. So Joseph Pilates obviously was the founder of Pilates, and he really utilized his skills or came up with this methodology
This is in the 1800s,
No.
1890.
No, like 1900s. We were like 20s, 30s, yeah.
Okay.
And he
Oh,
was,
fairly recent.
and he was helping like war veterans, so they would, be out fighting, get like blown off, or like, I know that sounds violent, but they'd be in bed,
Yeah.
basically. And then in infantry, he would go in and he figured out that these people needed to move, but they couldn't move. So he would use spring tension from the beds that they were in.
Oh, I didn't read that.
Really? So that's where the springs come from on reformers.
Yeah. And he'd move the springs around from the bed, like the box spring, and then they'd just lay on the mattress, and he'd have them use the springs to like
Really?
strengthen muscles like in their arms and their legs. And what he found in doing that is that they were getting stronger and they were healing and they were getting better. Because to just lay there and do nothing, even if, you're severely injured, it's really just a lot of atrophy. The muscles go away, the blood's not pumping as well, the nervous system isn't, able to work as well. So he just started using the actual beds in the infantry to create basically like a piece of equipment that people could use for strengthening without getting out of bed. So
I didn't know that.
That's crazy.
yeah.
I had heard, and correct me if I'm wrong, mat Pilates, which has no apparatus, right? It's just done on the floor,
Yeah.
was kind of born while he was in prison. Is that accurate?
Yeah.
And it was a prison workout, basically.
Well,
Like that's kind
and
of
I'm not as familiar with that, but he did end up doing a lot of the mat work because he did move to New York in the U.S. And then him and another lady, they started working with a lot of dancers. And that's why you see so many dancers incorporating Pilates into their programming. And, I work with so many
from that era.
departments.
Yeah.
Yeah. And then Romana actually, I even Moira Merrithew, who, I do Merrithew and Stop Pilates, but, she trained in New York and there was Pilates there, and then she branched off. But that was like the traditional, like original Pilates method. And they started working with ballet dancers basically to keep them healthy. So, and then that's why you see so many dancers and dance programs integrating Pilates. Like a lot of the dancers that I work with that have been to universities, they'll always have reformers and, do some type of Pilates for their dancers and staying healthy.
So if you can take a muscle, let's say an average athlete, let's take a 17-year-old high school football player who lifts weights, works out, maybe his fitness is fairly good. Explain what Pilates and what you do specifically with Stop Pilates, what's it going to do to that muscle? How would Pilates impact in a positive way that 17-year-old?
Okay. Well, this is...
And I know that's a broad question because you're very specific, but when we talk about lengthening the muscles, doing it under load, I think some of these terms are probably foreign to someone who's never
For sure.
had a Pilates course, never done any instruction, and never, more importantly, been on an apparatus, right? Which is a whole nother journey in and of itself.
Well, I would think if I had to pick one thing to really focus on, what I do with all of my athletes across the board is, with the exception of dancers, because you have to train them just a little different because they work in those end ranges of motion. But the thing with Pilates that is so important and really benefits these athletes so much is they really work their body in a really compressed position a lot. They're lifting heavy weight. They're training for explosion, wattage, power. So they train in the weight room. There's a lot of rigidity in it, which is much needed in any sport, right? Because we want them to have power and explosive movement. But what that does a lot of times is it shortens the tendons. And so then they can go stretch. But static stretching in the research has shown that you lose force production. So if they're statically stretching, but then they're lifting heavy in the weight room, it's very counterproductive.
Oh, really? I didn't know that.
So if you stretch, do static stretching before, say, a game, you potentially can lose up to 40%, 30% force production in your explosive movement.
Wow.
So, and most injuries, really high percentage, happen on the eccentric phase of movement, which means when the muscle's lengthening. So you can think of a basketball player, you see a lot of Achilles and a lot of...
Like Aaron Rodgers, you saw him when he planted off his foot.
And it starts to lengthen.
Yeah.
Well, they haven't trained their body to lengthen their muscles under load. Mm-hmm. So the minute they add speed and force, and these guys are strong, and these athletes are strong, and the Achilles, we'll say, use the Achilles for an example, starts to lengthen. Well, they've only trained it in this small range of motion. So as they push off and they have speed and force, they'll snap it. If I can get them on a reformer and I have, I can use light spring tension and I have the pre-tension and recoil, it doesn't matter how far out there they go. Like, they can't lose control because the springs would just look like they bounce back in or they lose control out. And their bodies, sensory-wise, are not usually going to let them do that. So, like, when I get somebody in to the studio and they haven't trained on a reformer, or these guys, that I work with that haven't trained a lot of length in their muscles, they'll start pushing the carriage or pushing against the spring tension, and their range of motion, maybe they can push out 4 to 5 inches.
Yeah.
So one of my first goals with them is to get them to get all the way out, get their tendons and muscles to get a lot of length under a lot of spring tension. And I don't mean just like, sometimes the lighter spring tension can create more load for the muscle, so that when they get out onto the field, they've also, or the court, they've trained fluid movement, right? Because the spring tension, if, as you guys know, because you've been on a reformer, if you lose control, you come back in and it bangs into the stopping point, so you have to have good joint control. So when they push out, and let's say their hamstrings, they're going into, I'll say, a simple lunge, right? And we do it on a reformer where they go out in their hip flexors, hamstrings are in a really lengthened position. Well, then from that eccentric place, they have to be able to contract the muscle to bring the carriage back
Under control.
If they don't, then they get out there in their sport and they start, like, they're going to lengthen their muscles, right? They're running, they're opening up their hips, they're doing a lot of lateral movement, but they've been training in the weight room, a lot of rigidity, explosive movement, heavy weight, which is great. Like, we want them.
You need it all, but
both, but then they are asked to go out, they'll lift heavy, let's say one day, and then the next day they need to go out and go to practice, right? When they're running, they're doing gassers, or they're doing, like a lot of jumping. If you play like something like volleyball, they've not trained their tendons to do that, so they just give way. So you see a lot of times in spring training or fall, where they've lifted heavy, and they have to go out and practice. That's where you see a lot of the injuries happen.
Yeah.
So I just train there, like, in Pilates. For me, if I had to, like, narrow it down, it would be really to get them a lot of strength with their muscles lengthened. Sometimes you guys have done it, so you'll push the carriage out and the muscles are lengthened. It's like you can't get it back in.
Yeah, you're like stuck.
Their muscles with them in a lengthened position.
Because everything has been explosive, and it's tightened things down to where they don't have longevity. The muscles, hardness, not supple.
Right.
And they can't handle it.
Rigid.
Under a light load. Like I've experienced this.
Right.
Right?
Yes.
I've stood and I've done many, many workouts with you. And the best way I can describe it is like a baby deer.
Yeah.
Yeah.
Be traveling.
Right.
It's like Bambi trying to walk. It's exactly what it looks like.
It is, yeah.
It's actually, if you go in with any ego to do your first workout with a proper Pilates instructor, with Jenny, the ego gets stripped back pretty quick.
Well, you go in, you think you're fairly strong or whatever sport you're in, and then if you're in a group class, you look to your right and there's a 65-year-old woman just kicking your ass. I'm dripping sweat off my nose.
Right.
And you're just like, what is going on here? It's so different than what everyone's used to.
Right, for sure. And what we've been taught in division and or being in shape. I mean, you guys know I get these pro athletes in and they're strong and they are fit and they've made it to the professional level. And they haven't done it not being strong or strategic about how they've gotten there. But I always say to them, because, it's humbling and you come in and it can be a little overwhelming, like what the heck. But I always say, like, you come here with it, like an injury usually is how I get them. But either way, like, you've had amazing strategies to get to where you are. There's nothing like broken or not strong about you, but now you are moving up to higher levels and a higher skill set. So you want to be better, faster, stronger. We need more strategies.
Yeah.
So when they come to Pilates, I just kind of explain it's just another strategy to get them to be able to move better and more in a fluid way, because usually they're not taught that.
Yeah.
I think it is, first of all, you have to commit to it. Like,
yeah.
From experience, I'm going to sidetrack a little bit here, but from experience, when someone who's done high impact training, or maybe you've been involved in sport, basketball, football, baseball, maybe cycling, or you're a runner, you get a little bit of a endorphin rush, or there's something that comes from doing that.
Yeah.
And it's much different doing Pilates.
Yeah.
And you have to kind of commit and start to see the improvement before it's just interesting. I can see how people might start Pilates or do it 1 or 2 times, test it out and be like, it's not for me, because they come away not realizing what the real benefit is. And the real benefit comes after several sessions, right? And you're not going to get that pump. It's just so different. I can't, it's hard for me to put it in words, but let's jump to, you mentioned pro athletes. So with the athlete, and we can use names or we cannot use names, but with the athletes that have come into you from collegiate that are now at the pro level, I think that a lot of them would attribute their success and their minimal injuries to having worked with you. What's been your experience when they came to you, and how's that been with these athletes?
Well, if you get them injured and they're playing at the collegiate, or
is that usually when you get them? Is when they're injured?
I get a lot of them in high school, but usually they're pushing to get to go to college.
Yeah.
But usually you see it, especially with sports now in high school. There's just so much, right? The volume's higher, their strength is different. We know how to. There's just so many things that they use, and it's overtraining for kids that age, really.
Right.
So, but they do it, so we figure out ways to, they can stay healthy. There's just a lot of maintenance and things that they have to do. But when I do get, collegiate players or pro players, I usually do get them injured. They've come, I always jump on the last resort. Either I'm like, I'm going to change the name of my studio to Last Resort, just kind of the joke. And so their intention is really like whatever's going to get me better, I'll do that.
Yeah.
Right. So it's not like coming in like, is this going to make me more fit? But then they find that it definitely makes them more fit, and then they stay healthy. I mean, I had one of the first players I worked with, I remember asking him, so many years ago, probably like 10 years ago. I said, you're so busy, like they're busy schedules, like they have morning practices and afternoons and they're busy. I said, how do you make time to come in here 3 days a week? Like, or why do you choose to do that? And he really was like, it was so simple. He's just said, because it works. I haven't been injured since. We were like, 10 years into it. And it's true. Like, as long as it works and they stay healthy and what I'm doing with them keeps them healthy, we know it's working.
Yeah.
And that's they really find a deeper connection to their bodies, like their sensory neuroreceptors. I use mirror neurons sometimes to help them, and obviously our motor neurons. So they really they get better perception of where their body is in space. They really start to feel their bodies, and what their surroundings. So their reaction time usually goes up if we're training the nervous system properly, and their muscles can fire quicker. The fascial system gets trained so they can move more fluid. And I always kind of try to explain to them when they come in and educate them that, look, there's a time to train for rigidity and there's a time to train for fluidity. And when you get both of them to work together, that's really where you see kind of, not to sound cliche, but the magic happen. That's where you see these athletes just go to such a higher level. Because if you're just training in the gym only, or you're just doing Pilates, you're not training all systems of the body, but you can get them to integrate. So they can train hard and explosive power, but then they can get on the field and they can change direction without jarring through their joints, or in smooth ways, which is more of a coordinated thing to do. And training the fascial system is really what creates that smooth, fluid movement. So as long as they're training in both ways, that's how they stay healthy.
Explain the fascial system, because you and also you mentioned something, being connected with your body. Those were the words I was searching for earlier. Because you start to feel, oh, this is how I get my abs to engage. This is how I get my stabilizer muscles in my hips or my ankles to actually put in some work. So I'm not just, my joints aren't just like floating with no stability, right?
Yeah.
But you said it, and those are the words I was looking for. But talk about the fascia system, like, and that whole piece.
We need to, for sure, oversimplify it. But fascia runs through our whole body.
Don't simplify.
It really is like the scaffolding of our whole entire body. So we have different types of fascia, which is just connective tissue. You see it in pictures. I'll try to simplify it so that everyone...
And fascia, it's like basically in between your muscle and skin, right? Or is it it is.
So every muscle fiber in your body at a cellular level has its own little sleeve of connective tissue. And then, you like what you're talking about, Seth, is that like you see the paramecium, like if you cut through a pork roast,
yeah,
you kind of see those compartments with the white stuff. That'd be more like paramecium. Our leg will look the same way.
Okay.
And then you have like, kind of a body sling. So it really, there's nowhere in the body at a microscopic level, and then every tiny little muscle fiber has its own little sleeve of connective tissue. And then, you guys see it in pictures. If you see a picture of a body, you'll see the white stuff that runs down the spine, which is thoracolumbar fascia. And that's the kind of stuff that people will see. But that tissue is not like, it doesn't respond to the same stimuli that muscle tissue responds to. So like when we train musculoskeletal system, it's muscle tissue. It's the stuff everybody has been taught, right? Like quads, glutes, but tendons, ligaments, that fascia that surrounds compartments of muscles, that they contain a lot of what we call sensory neuroreceptors. That's what tells us where our body is in space. And I always kind of use the example as like, even if I told you right now, Steve, like I said, okay, I really want you to stand up and lift your right leg. Like right now, you're already you kind of already did it. And you're kind of like, should I do that? So your body already, that system already fired in anticipation of you doing it. So that when you got up, you just didn't collapse over. Or if you were just using only motor neural receptors, you would stand up and your muscles would give out. But, higher level athletes, like if I were to say to somebody, okay, I want you to lift your right leg and your right, before I finish my sentence, they're already doing it. But they've already experienced it. And if they have injuries, a lot of times you'll say, okay, I want lift your right leg, and they'll stand there for a second and they'll kind of try to find their balance and be like, I don't know if I can do that. But before they ever tried, they already could feel in their body that they couldn't do it because they've had an injury. And so there's a break in the fascial system and the sensory system. So we should be much more concerned about what's coming in than what we put out. So if you're playing a sport, or, we can use biking because we were just chatting about that, but it's not like you hit a rock on a mountain bike trail and you didn't know it was there. Like your sensory of knowing what's up ahead of you, your body's already responded to what's ahead before you ever get there.
Yeah.
If not, then you're,
it's like you see a pothole when you're driving and you kind of brace for impact before you hit it.
Totally.
Similar. Yeah.
Same thing. So what with the fascial system, one of the things, the words that I use is when I have people call me and ask me like what I've been doing, or people go back to their facilities or their sport and it's out of sync and they want to know what I've been doing. It's a bit tricky if you don't know a lot about the sensory system, the fascial system. Because what I say is I train these athletes what I call underneath their awareness. So instead of just training their central nervous system, I'm training their autonomic nervous system, which is, we hear like the sort of buzzwords right now are parasympathetic nervous system.
Yeah, sure.
Sympathetic, like fight or flight. But we see those are such extremes, right? Like we want to, like even us doing this right now, we're in our sympathetic, we're up, we're ready, we're chatting. Like we really want that to be on. But it gets too high, too low, or where it can't respond as well from injury, from pain, from high level sports, especially adrenaline. I mean, just our busy, stressful lives in general. It can break that down.
In your experience, that fascial system and you're so eloquent with the way you explain it, because having done this, I can feel it when you're saying, yeah, oh, that makes sense. In your experience, is that just been completely neglected in most humans, most athletes, where they haven't? Because you've used the term with me that's like, it's hard as wood, or it's like driftwood in there. It's hard. It's not soft. It's not supple. Mm-hmm. And so we would spend 20 minutes figuring out like, why are my shins this way, or why is my shoulder this way? Is that just because that's been neglected? Or explain that a little further. What happens to the human body if you don't give that the attention it needs?
It just can't stay healthy.
Okay.
Bottom line. Like really, I mean, that sounds pretty like, non-negotiable, but you just can't stay healthy. The connective tissue is what really allows a lot of slide and glide. We have like high levels of innervation, and in some, when I teach courses that involve more musculoskeletal, we'll talk about those deeper muscles around the joints as local stabilizers, but they really are primarily white. They're made up of more of a connective tissue type of
tendons,
tendons, ligaments, where muscles come together. We have like myotendinous junctions. I mean, you see it with the calves, like that. People have that visual where it's like really red and then it comes down and then the Achilles is white. But it's just that tendinous part of those three muscles that make up the Achilles tendon and then goes under the foot.
Yeah.
That's all through our whole body. So really, when I get people in and they're injured or they've had surgery, or I always I'm not as concerned about what their injury is, but how they got there. Because their injury, they come to me.
Yeah.
Right? Like, we gotta let it heal. We gotta do the proper steps, biomechanics, put your bones in the right place, get the muscles firing and some symmetry. But how did they get there is always what were the predisposing factors? Because if I can figure that out, then I know they're not going to do it again.
Yeah.
And if I can explain to them how they got there, then they won't do it. They won't get injured again.
Prevent it.
Yeah, because it really is. You would think that, I mean, especially like with the football players, the majority of their injuries, believe it or not, are not contact. You would think they are, but they're really not. And there's just a lot of speed and force and acceleration and deceleration. So we train that.
Yeah.
But when I start to see the asymmetries in their bodies because of repetitive sport, then we start to fix those asymmetries so that they aren't so far out of where their neutral body should be.
Yeah.
Which is a little different and unique for everybody. And really, you can keep them healthy. Like, so
Yeah.
a lot of the guys that I work with are women too, like that I see most days of the week. We're just constantly just keeping symmetry in their body. And nobody's perfectly symmetrical. I mean, I was teaching somebody today and we were talking about his stance, like he's a linebacker and he likes to drop his knees in. And sometimes he'll feel like his foot pushes off. Well, he's just using some muscles to push off that we just kind of had to repattern. And he's highly trained. So, we just kind of worked on it for a minute and he didn't feel anything in his foot. And he tends to kind of jam that foot a lot when he's out playing. So we're doing corrective stuff right now because we're in the off season. But if I can kind of figure out how they got the injury, because I always think there's a reason. Like my theory is like there's always a reason, and almost always there is.
Every human.
Port hernia, hamstring, even if it's like a hamstring, right? And they were running down the field and they, caught their foot on the turf or whatever. I'm like, well, why didn't they do it to their right leg and not their left leg? And then I can usually look at the system, and the fascial system is really where I look, how those fascial sling systems work from the shoulder to the hip to the knee to the opposite ankle, something like that.
Yeah.
Like they will always injure their right side if we don't fix that.
Yeah.
Then I just go back and while they're healing, we let them heal, and then I correct what caused it in the first place.
Yeah.
Because they'd be more likely to do it on one side. I mean, even cycling, I was working with that cyclist today. I mean, I don't know if I should use names, but
You can use names.
okay, he hikes his hip on the left side, and all his pain in his knees on his left side. So when he rides a bike, it's like this. And over time, it gets a little more like this and this. So it's pulling up on that knee. It's not going to hurt his right knee, but his right hip's going to probably start bugging him soon enough, right? Like,
Yeah.
there's load going down. But that's like, so if we can just kind of get him somewhere in the
Balance it out.
and nobody's going to be perfect, right? Like, so what we want to have him not get into those end ranges, which is kind of where he's gotten, where the knees were like bugging him. But he's young, he's not injured yet, so that makes it easy. But if we can kind of keep him here all the time with some maintenance, easy corrective movements, with the high volume that he rides, he's not going to get injured. And his knees aren't.
Yeah, you can prevent
You
it.
don't need him to be perfectly here. And to be honest, like, he's strong riding his bike and getting that extra push on that left side. So do it. That's what got him here to begin with. And then we do corrective stuff outside of the sport.
So for the average person who's just they ride their bike 3 hours a week or they run 2 hours a week, and maybe they don't have access to a reformer or to a Jenny, the witch doctor, because you mentioned static stretching. That's what a lot of people go to.
Mm-hmm.
What should they be doing? Is static stretching okay in couple with something else, or should they be doing something completely different?
Well, it's very controversial amongst people with static stretching, but I don't. So this is just my own personal experience and the athletes I've worked with over, the last 20 years. But I really don't. I don't want to say I don't let them, but none of my athletes do any static stretching.
Oh, really?
Like I always say, if I'm the person that's responsible to helping you stay healthy, then I have a few rules that are non-negotiable. The rest of them we can negotiate, but one of them is no static stretching because I don't know who's for production.
Mm-hmm.
I want to know this because I just started stretching like the past month every night, so I need to know what to do.
Yeah.
Besides that,
There's a lot of stuff you can do because a lot of times a lot of the guys I work with, they don't have reformers or Cadillacs or whatever in their places where they go, but we can utilize like bands. We can utilize so much like small equipment where they get a couple little balls or stability balls, and we can get them into those end ranges with some bouncing. The fascial system, which I mentioned earlier, responds really well to different stimuli than muscles. So a lot of times the injuries and the great strains and the tears that we see are happening within the connective tissue, not necessarily the muscle. So when you stretch your muscles, and you do like sort of, I'm guessing you just picked some stretches that you saw on something.
Yeah, sit on the floor, touch my toes, butterfly stretch, yeah.
And you're stretching muscles, but if you really want to get the flexibility and mobility, which are two different things, you really want to do things like, these are just basic. There's so many different stimuli you can use, but like bouncing, swinging, textures, pressure, things like that to stimulate the connective tissue and get those neural receptors to relax so they're not squeezing the muscle fibers so hard. Because if you're stretching and you're just stretching muscle, then you're stretching the muscle but not the connective tissue that's surrounding it. And then create more little micro tears. So what, like, for instance, when you say, what would you do? I would get like a band, let's say, and, if you have doing a hamstring stretch and kind of bounce your foot in the band a little bit while it's upright, just let it bounce in kind of that end range and let it bounce for 30 seconds.
Okay.
And then the band has the sort of the pretension and recoil or the elasticity that like springs would. It's just a different force going through the joints. But instead of just holding the stretch, that bouncing sensation is a type of stimuli that actually relaxes fascia or connective tissue.
Okay.
So then you're getting mobility and flexibility. Because if you're not, like if you started stretching because you wanted more flexibility, it will happen in your movements, but you won't get more mobility.
Interesting. So tell me about flexibility and mobility.
Yeah.
Tell me, but that sounds the same to me.
Yeah, and I think it's taught that way, but mobility is what we want in the joint. So if, let's say I have somebody that plays defensive end and he needs to rotate his spine. Well, he doesn't need to stretch his spinal muscles. We need to mobilize his spine. So we do low load. We had like a kind of a bounce sensation or a tapping. So he gets the mobility first. My continuum, I guess, so to speak, of rehabilitation is always mobility first, stability and endurance. And then we can kind of move into like the power, the strength, the sport. So if we mobilize the spine in rotation, side bending, or we mobilize the shoulder joint, then the muscles can work in more ranges of motion. So that we want joint mobility first and then flexibility second. Because if you start stretching muscles and you get more flexible in the muscles, but the joints are really stiff and stuck because of the fascial system, well, then you're generating a lot of tensile forces, shear forces. Shearing causes a lot of like breakdown in the joint, and then you get injured.
Yeah. So it's getting the foundation right, making sure your tendons are okay, and then working on the big muscles, the strength, so you don't end up like Bo Jackson blowing your hip out because you're too strong, but you don't. Yeah. Your small muscles.
That's really what happens. I mean, athletes get so strong. It's when you come to Pilates, and like to go back to Steve being like, it's so humbling. It's not a lack of strength. It's a lack of training of the sensory system. And once we get that tapped in, then you can really access the strength that you worked so hard for, right? Because these guys are lifting, and I mean, they're dedicated. And you guys, like with even just all of us that work out and are consistent about it. And I ask the people I work with, do you ever feel like you work so hard and you don't feel like you're getting stronger? And they're like, yes, all the time. But it's because they're not utilizing all the layers of the fascial system and the muscle system. So, I mean, sometimes within an hour, I can get them in there, and like, I always joke that they just make me look good, because I get people like you guys or these high level athletes, or like, you're talking about Taylor coming in one time, and it's really like, I mean, really getting a body in there that is a high-level athlete. They're strong, they're fit, they generate a lot of force, and I just pull it back a little bit and start training the sensory system and stimulate the fascial system, and they're good to go.
But your diagnosis of what's going on is so valuable. Like, that's where the value is, because if you go back to, well, let's not talk about when you got injured or how you got injured. So let's talk about before then. Yeah. And you kind of take it all the way back to like, what's the root of this? And that doesn't just happen from a textbook or a school book. That's years and years and years and decades of layering on, seeing athletes and knowing about the human body and how it reacts and what's tied to what. And I'm going to try to describe it, but I'll butcher it.
Yeah.
For those who are listening, let's talk specifically about maybe 2 or 3 different arenas, because everybody is an athlete at something, right? They want to do something, or they participate in something that requires physical activity. Let's start with just cyclists. Okay. So the majority of cyclists that come to you, what's typical? Because it's this repetitive movement, and we'll have several people listening to this who are cyclists, and they're like, oh, my knee hurts, my hip hurts, my lower back hurts after a 40 miler, or my neck hurts, right? What do you see over and over because of that repetitive movement where everybody is different, but what do you...
Yeah.
What happens traditionally with cyclists, specifically cyclists?
Okay, you can definitely kind of like get those, even though every unique body is unique in their fascial systems, you really do see a lot of things across a sport, like a cyclist versus a linebacker versus, a volleyball player. So one thing, well, more than like, I guess probably most of the things with cyclists, and I'll say this like a sort of a caveat is, and I say this to everybody, is that there's no sport, not that I know of, is biomechanically correct. There's none.
Swimming?
No.
Really?
No.
Because that's kind of, people are...
Inside all the time.
Oh, yeah.
How you're like one arm, and you're going to always have a dominant side. So even though like you see cyclists, it's repetitive and it's in one plane of motion, it really is... there's no, the head has to be up, the neck is compressed out at C3, C4, the pelvis is in a posterior tilt, and you're rounded through your shoulders. Like, it's not...
Yeah, and not ideal. Nothing is lateral. It's all just...
So, like, when you get a cyclist, you're not going to be like, in Pilates, we are always like, keep the cervical spine in line with the thoracic. Don't do that if you're riding your bike because you'll get hit by a car or, fall off of your bike.
Yeah.
So I'm never asking them, these athletes, and I think we're all athletes in our own right, whether it's recreational, professional, it doesn't, as long as we're moving. But so we want them to do their sport and we want them to do what makes them good at it. So when people come into me and they've been injured, I really try to make sure I tell them, like, we're going to work on biomechanics, neural receptors, neural therapy, but whatever you're doing on the field or the court or the bike is working. And as you get more symmetry, you're going to get more power and you're going to get, less injury. So with cyclists, usually we're either right-handed or left-handed. We're stronger with one leg than the other. So you are having to flex the hip and the knee, however many times, depending on how far you run.
Yeah, hundreds of times, thousands.
You'll get like a lateral tilt through the pelvis. So one hip will be higher than the other. And that's just, you're pulling up, you're trying to push harder with one leg. You have more power in that leg for whatever reason. Then let's say they're going and they're lifting and nobody's brought that to their awareness. And so they're going to lift with their hips in a lateral tilt. Where if you can teach them that and they do that on the bike, but they go into their lifting or their Pilates and we do corrective movement, well, then you're lengthening a muscle on one side, you're shortening it on the other, and you're creating some symmetry.
In fact, it's between the two.
Yeah, so when they go back on the bike, they can kind of, I'm not going to be like, don't hike that hip because it's working. They're winning. They're, they feel good. But as you get symmetry in muscles, that just naturally happens. So then, in that flexed position and with the pelvis in a posterior tilt, we know that the abdominals don't fire as well. A neutral pelvis is really, we get the most access to our deep spinals and our abdominal muscles. So, but you're on a bike, you're sitting, you're not going to be, in neutral. So we do a lot of corrective stuff with the pelvis and the spine in neutral, the abdominals in a more lengthened position because they're so shortened when you're on a bike, so that you're strong in both places because you're not going to not be that way on a bike. So if we can kind of open up the body, you think about, the body being hunched forward on a bike, everything you do that's corrective is going to be to strengthen the posterior chain. They're really kind of collapsed in the front chain, which is the anterior chain. So a corrective thing to do with, if you're a cyclist, would be to really strengthen posterior chain. But you do have to be pretty specific about where your bones are because you really, whatever your sport is, sometimes shapes your body. And the more you do it, the more you shape your body that way. So you'll see a lot of times with cyclists, they are standing upright, but they've got shoulders forward, rounded through the upper back, and the pelvis is going on.
Yeah.
So then they're going to be like, okay, listening to me right now and say, okay, well, I'm going to go strengthen my posterior chain, my back muscles, my hamstrings, but they're going to do it with a posterior tilt.
Yeah.
Shoulders and around its spine, and that's not going to do it. So you have to really get your bones in the right place, and then you can access the muscles in the back of the body.
You can almost spot a sprinter versus an endurance rider that's going to be a great climber or a great... because the one is, he's not tucked under. He's got more of like I wouldn't say athletic because that's maybe an athletic build. They're going to be a sprinter, whereas the guy who can go and climb forever, his hips are sometimes tucked under, his shoulders are rounded off. He spent so much time just in that motion. What about golfers? What do you see with golfers?
Well, a lot of back and knee pain.
Knee, really?
Yeah. Sometimes if they're really tight in their shoulders and thoracic spine, and they'll get like some elbow issues, like we have like tennis elbow or golfer's elbow, and that's usually just poor mobility in their shoulder joint. So they're getting a lot of rotation at their elbow, which is a hinge joint. It's not set up to rotate as much as the shoulder joint. So that's a pretty easy corrective, but there's so much speed and force and tempo with golf, and they always swing their speed in one direction.
Yeah, that's the same thing.
Yeah, so it's right arm and, they're right-handed and they're swinging. Your wings that rotate you to your left are going to be really short and developed, and just try to get them to rotate to their left, or towards their right with their left wings, and they just get stuck. So really getting symmetry through the spine so they have rotation in both directions is really going to help the muscles support the joints. So otherwise, it's kind of, you can see if I get golfers in, which I'm working with a few right now, and it's like they're almost going to start walking in a circle of the direction, but they swing their club. So then when you get them on something where they have to like put equal weight on both feet, they will always shift over like to the left and swing their whole pelvis one way instead of really getting the spine to rotate on its axis and using the glutes and the pelvis to really get some power.
Yeah.
But golfers, you really see, they'll stretch, but they really need some good mobility. And again, golf is not like biomechanically correct, right? You're going to get some in the knees, and you're going to ground through your feet. And then at the end of the swing, you have to get extension through the spine, which is kind of like more of an arched back. And so if they don't have the ability to do that, then what they'll do is they'll create like shearing, usually through L4, L5, S1. So you get a lot of them in with knee pain, herniated disc, and then you kind of have to pull them back and create symmetry.
Where does the knee pain come from? Just from the back? Or twisting the knees?
A lot of speed and force.
Yeah.
Yeah, so the knee is obviously a hinge joint too, and it's not really set up to rotate. We have something called your screw home mechanism. It creates a little rotation so we can have a normal gait pattern or walking pattern. But when you're golfing, there's so much torque. And the faster your speed and the more force you can generate, then the more twisting, like rotational forces you're going to get in the knee and the ankle and the spine.
Yeah.
And you have to train the body to make sure it can withstand those forces. You get so strong, and speed creates so much force that you actually have to train the muscles to be able to withstand their own speed and their own muscular contraction. Because you can actually like measure, the guys I work with, like at a collegiate level, they'll do like muscle testing, and they'll test like say their quad on their right versus their quad on their left. And just the other day, because I've been working with a kid who had injury, he could generate 800 pounds of force like through the right quad and 500 with the left. He had an injury on his left side a few years ago before I knew him, and so that's going to create and it created an issue up into a sports hernia, which was really how I originally got him. So it really, with golf, it's so repetitive, but it's also one directional, which makes it tricky.
Baseball, I would assume, is similar. Tennis.
Golf.
What about these old folks that play
pickleball?
Is it?
Oh my God, it's so funny because I always do it because I do a lot of education, like internationally, and so I'm always curious, is this a Utah thing or is it, but so I was like, how many of you teachers or like PTs that are in the people that I do education with are having pickleball injuries? And they're like, oh my God, like it's just
everybody.
Yeah.
That surprises me. It's fairly low impact, but I guess it's old people playing. So that doesn't help.
So many people listening right now, they're
like accessible, like people can do it, right? If you're not like an athlete or you're not, it's a small course.
Also, you don't have to be athletic.
You don't have to be athletic.
Everybody listens pissed right now if they play pickleball.
It's accessible. How's that?
It's a great sport.
I do
think it's awesome.
There's twisting and it's, arm speed, and certainly like, I think that like tennis is such a big court, right? So pickleball, that's a lot of running and directional movement, lateral change. That's different. Pickleball, you're in a little court, it's a little more contained, but it doesn't change the fact that like a lot of these people have never trained their body to change direction quickly or their swing speed. And so they're doing, especially, as we lose elasticity, so instead of calling them old people, age, and we lose elasticity, and they're like, I gotta get the ball. They're sensory-wise, they're going to get the ball. However, they've got to do it. Sometimes if they lost elasticity somewhere, they're going to get it in their knee instead of their spine. Or they're going to get it in their, their hip or through that lateral through the pelvis so they can get to the ball. And then, they're not going to withstand, if they're playing pickleball a few days a week, even if, I mean, I know some people play every day of the week, their body just hasn't been like trained to withstand that kind of force, you know, which I know is much different than like a pro athlete, but it's not really in the sense of what they expose their body to, you know.
Interesting.
With, and we've covered a few sports, but like with football and basketball, I don't want to bulk them together. Well, let's talk about runners. What do runners, maybe those listening that probably are seeing the same end, what's predominantly common with runners?
Oh boy, runners. I mean, I get running into the studio or in my courses, I'm always like, oh, good, we have a runner. Because they're so mentally tough, right? Like, you're not running hard. You're not running marathons without some level of dissociation from your body. Like, that's a suffer fest. Sorry to all you runners out there, but they are mentally so tough. So getting them to feel their bodies is really, really important. You can, you know, they can come in with a pretty severe injury and you can say, like, you know, start working through it. And do you feel that? No. Do you feel that? No. Do you feel anything? No. You know, so, but just like cycling, it's a very similar, it's very similar patterning. It's sagittal plane. Everything's, you know, one plane of movement.
What's sagittal plane?
Front and back.
Okay.
So it's like you're not moving side to side or rotationally. So with running, you rotate the thoracic spine a little bit. There's a little bit, but for the most part, it's linear.
Yeah.
You know, and so it's so repetitive, and then it's high impact. But, you know, a lot of times people will have foot posture, which goes back to the fascial system. So they'll start running, same thing with like rounded shoulders, pelvis pulled under, you know, and then anytime the pelvis is pulled under, whether it's cycling or running, it's going to create a lot of tensile force through the ligaments back there. And that's why you see a lot of...
Which ligaments?
Ligaments, sacrospinous ligament, sacrotuberous ligament specifically, because they really...
English.
They're like white tissue around like that sacrum, tailbone.
Like connecting to your lower spine.
Yeah. So it gets like really like, it's like somebody pulling your pelvis down towards the floor all the time. Okay. So you're sitting on a bike and your pelvis is going under. It would be literally like somebody creating a tensile force to pull the pelvis down towards the floor. So that then if you're pushing, you know, or you're running and you're getting impact from the ground up, or you're cycling and you're pushing down, it's just going to create more tensile force, which is more just like the force is pulling the tendons apart rather than keeping them stable in a neutral position with some like retraction and like condensing and expanding.
Football players, basketball players, it's predominantly where they're doing a lot of strength training, right? Mm-hmm. And I know you work with a lot of football players. Is that all over the map, or is there some commonality to what they struggle with and where their durability is as well? Or is it kind of all over the place?
Each position definitely has its things.
Position specific.
Yeah.
Okay.
Where you really see linebackers, even though they all play so differently, right? And they kind of work to their own strengths and how their anatomy is set up, you know, because everybody that I have, you know, the way their hips sit in their socket is different than the next person. You know, some are more medial and they just come that way. That's their anatomy. So then we want to work with that because we're not going to change their bone structure. We want them to work within it. But some bone structure can contribute to certain injuries more specifically. So once I kind of see their structure, and usually I get x-rays or some kind of images because they usually come in injury so that I can see what their actual bone structure is. But I would say across the board, I mean, I could say this in football, but people in general and definitely athletes, because the volume and the force and the speed is higher because, you know, like they train their bodies in a different way in a lot more volume. But I always start whether it's a shoulder injury, a knee injury, a hip injury, a foot injury. I always look at the lumbopelvic area first. It's the driving force of our body. It's set up for weight bearing. Weight is set up for load.
Say that again,
lumbopelvic. So it's the lumbar spine. So like 1 through 5.
Yeah.
Then your sacrum that sits underneath it.
The sacrum. Tanya's always talking about the sacrum.
That's a common thread.
Yeah.
I think every single sport you've mentioned, basically your hips, all of that.
Mm-hmm.
Yeah.
The hips are big. They sit deep in the socket. They're set up to take hundreds of pounds of force. And then if you train your muscles, then that sets you up to really be able to absorb hundreds of pounds of force. Your ankle, not so much. Your knee sits between the two longest bones in your body. So if we can kind of, even with shoulder injuries, you know, you see like there's a lot of asymmetry or lack of strength in the core muscles. And when I say core, I don't mean like your six pack. I mean deep transversus, deep spinal muscles, you know, those like fascial system. if you can really train the lumbo-pelvic, like if I get somebody in who's had shoulder surgery, I start with their pelvis, their lumbar spine, see how their structure is. And once I start strengthening all the muscles around that area, I'm 60% there, and I can
Really?
the shoulder.
It's all like that's almost the central nervous system.
Always. Because really, like, even like a lot of these football players, they can generate, hundreds of pounds of force with their pec major, lats, anterior delt. And then, so if they're stronger there than they are in their core muscles, then when they're out playing, they're always going to use that. The body's not set up, the shoulder's not set up to generate that much force through the body, but they will figure out how to do it. And
until it breaks.
NFL or wherever they, that high level, until they can't anymore, which is usually when they get.
Is that a when, not if, for most people?
Yeah, for sure.
That'll eventually break down and they'll have problems. What are your thoughts on, well, I probably know your thoughts, but on surgery? Obviously, if a ligament's torn or whatever, surgery is probably the only way to go. I can't imagine you can fix a torn ligament. But are there injuries that people are getting surgery for that could, not easily, but could be fixed with the right exercise? 100%.
Yeah. But
it really is. I feel this way after doing this for 20 years. It's really got to be such a personal decision. I feel like I can take any injury unless the ligament has torn off the bone or the tendon's torn off the bone where they have to go in and reattach it. I feel like the body's ability to heal, if you're training the nervous system and the muscular system and the fascial system, will heal. So I have a few players I've worked with for so long, like, some of them 10 years, some of them longer, and like even 5 years. And they trust, because every time they've been injured and not had surgery, they heal and they've not re-injured.
And doctors have told them to have surgery?
That's why I really kind of about being last resort. I
have personal experience with this.
Really?
Do you remember this? So in 2017, when I first came to you, this is so stupid, but I'm going to be vulnerable here. I woke up in the morning and my back had been hurting me a little bit. I had snowmobiled like 7 or 8 days in a row. And snowmobiling it's hard on you, right? Mm-hmm. And I was exhausted, wasn't sleeping a ton, but I was just playing, like constantly playing. And after 7 or 8 days, I woke up in the morning and went to stretch, just, the classic stretch. And my back locked up.
Right.
And Anya wasn't home. I wasn't home. You're laughing because
because I know the story.
Yeah. So I was like, oh, I couldn't move.
I remember.
I could not move. And I ended up on the floor next to the bed. And Tanya came home. I've been there for probably 30 or 40 minutes. I literally could barely breathe. There was no way I was getting off the floor. And Tanya came home. It's like, what the hell? What is wrong? What the hell's wrong with you? And I was like, my back. I can barely talk. And we kind of managed it. She got an eating pad or something. I was able to get up. And after it kind of calmed down, it was just like in so much pain. And I went and got a MRI. I went and got x-rays, MRI at Salt Lake MRI. And then I came to you. Mm-hmm. And you're like, hey, can you get a copy of your MRI and all this, because you wanted to see it. And I had already been to a chiropractor and I had already been to a physician. And both of them recommended that I was probably going to have something done. I had a bulge disc, if I remember right. You probably don't remember.
No, I do.
Do you?
It's all coming back.
Okay. I had a bulge disc or 2 bulge discs. And I was feeling I could move, but I was still in pain each day. And that's when I first came to see you.
Yeah.
And you're like, dude, you're broken. This
I did not use those.
You probably didn't, but I knew I was broken. My ankles, my hips wouldn't move. My back was in terrible shape. My lats were just tight and pulling on everything.
Yeah.
And after, I don't want to exaggerate, but I would say after 60 or 90 days of twice a week, you figured out how my body works. Mm-hmm. And I'm kind of anti-surgery. I'm afraid of it, to be honest with you. I've had one surgery on my ankle way back in the day because I broke it, but I'm anti-surgery. And so when you started to get me better, I was like, this shit works.
Yeah.
And then we worked on other things. And then as I started riding my bike more, I felt so much more comfortable on my bike with the specific things you were doing with me twice a week.
Yeah.
So I understand Seth's question, but I also have experience with, I was being suggested that I would have to have something done to repair my back, and that wasn't the case.
Right.
And I was feeling significantly better 4 to 6 months later than I was before getting injured.
Yeah, that's the hope. I always say, if you come to me and we do it right, and we get your injury better, when you go back to your sport, you don't even think about it. You're not afraid of it. You're not afraid of hurting it, because we've changed so much of your sensory system that you sense that your body is safe, and you never think about the injury again. That's how I know I've done rehab right, is when they get back out in their sport and they're not thinking about, oh my God, I don't want to hurt this again, or I don't want to, we've trained everything. And so they feel stronger than they did before. And, they come in and I always say, if we do this right, you're going to feel like a better athlete when we're on the other side of this. And they're like, no way. But that's always my goal. And I usually get there. But I really am not, I'm not anti-surgery, but this is what I've experienced in general. And this is, if I had to say any of my methodology, and this probably goes down a different road, so I won't go too far in it, but when I train athletes, I always say right away when they come in, we're going to train the physical body, but we also have to train the mental body, emotional body, and spiritual body. So, and I don't really care what people believe in. It doesn't matter to me whether it's the stars or, it doesn't matter. But they do have to believe that they can heal. And otherwise, you're really fighting just your physical body all the time. And so that sensory system is very much what connects us to our body. And being injured is really, really emotional, and it's heady. I call it heady, which is mental, because you're in pain and your body hates being in pain. So your body's going to tighten up. It's going to brace down. You're going to be up in that sympathetic nervous system over and over and over. It's going to be really hard for your body to come out of that. And that's not a good place to heal. So I work with the nervous system a lot to really get the body to come down into more of a rest restore state, and so that their body can actually heal. But I always say, like, if somebody's been suggested surgery, I say, and they're newer with me. If I've had them a long time, they really generally don't consider it, but if they haven't, then I tell them, you have to do what feels right to you. So, for instance, he's not a kid, he's a man, but he's young and he plays football at a D1 school, and he had a sports hernia, which is pretty severe. And I don't think, he didn't, to me, need surgery, because it would have healed. But he had some trainers and some people tell him that if he did it would rip off the bone. And I knew the minute that they told him that he needed to get surgery. Not because that's true, but because now mentally, every single time he's out on the field, if it hurts, if it pulls a little, if it's anything, he's like, oh my God, it's going to tear off the bone. So getting that surgery made him feel like, well, I got the surgery, so it's not going to happen. That's not necessarily true, but that's what he believed.
How mental, this is interesting. I didn't know that we would go here, but how mental is your body repairing itself? Like, can your body, I'm not phrasing that right, but that's interesting, that approach, because I understand what you're saying, that he in his own head would be timid, almost like he would think that, hey, I'm going to get injured again because this physician said that I needed the surgery. But what show is it with, there's a show about an old show, and I think the guy's passed away, about people just being able to heal themselves. I'll think of it before we get done. But how mental is the body healing itself?
This is my own percentage. I'm not making, this is like Jenny, but for me,
Science of Jenny,
70%.
Really?
Yeah. Mm-hmm.
Why?
70%.
If it's in the right state of mind.
They believe they can heal, they will heal. And then if I do my job right, and I get their sensory. So we store a lot of our emotions in our sensory system, right? So I always kind of use this as an example. Sometimes you'll hear a song, you'll be like, oh my God, that reminds me of 7th grade this. We store everything in our body. So if I'm training their sensory system, their fascial system, and their different neural receptors in a way that they can start to feel their body in a different way, they will feel their body healing. But in our culture, in sports culture especially, it's taught, get surgery, rest, start weightlifting, go back. And that's just usually
black and white.
Yes, black and white. It's almost skeletal. So, but if I can get these, I always draw a little X and I put at the top physical body, because that's what they're the most familiar with. And then I put mental body, emotional body, and spiritual body at the bottom. So if they believe that they can heal, then they do. And I could give you I mean, I had a kid last year. He had a fracture in his T7, and he was just kind of getting worse with whatever program he was doing. So he came here and it was a minor fracture. And I said to him, if we do this right, by the time you get to the combine, you won't have a fracture there. You have to come every day. And so he did. And then I was sweating it. You know, he gets to the combine and they do obviously x-rays, MRIs of every part of your body. And he had texted me that Friday, like, great news. No fracture. And
First round draft
pick. Yeah.
Wow.
Yeah. And then, like, I mean, one of the kids, which you guys know is like near and dear to my heart, but his brother too had come to me with pars fractures and slippage, you know, spondylolisthesis is what it's called. And they had told the one, like, you know, you could fuse your spine. They're probably not going to be able to play sport again.
This is when he was young, right?
14,
And
15.
I remember you telling me this story. We'll just call him John, I guess. We're not using names.
Yeah.
He couldn't even walk, right? He was just shuffling in.
I shuttle up those stairs and awful.
Like, but almost like bored. He might not play football.
You might
Right. He might not. Yeah. And now he's a D1 athlete, probably a first or second round draft pick.
Hopefully.
Yeah.
But I mean, we really did, you know, and usually with that condition, and the doctors will tell you that those fractures will never heal. And a lot of that's because it's a weight-bearing area of the body. It's load-bearing. And I always am like, everything heals. Everything heals. We can get it to heal. That's sort of my mindset. So I really, because it does. I mean, so far, so good, you know. But I mean, we had to make adjustments, and there might be limitations. But in his case, he was young, so I feel like those young ones are like Play-Doh, you know.
Yeah.
Pack them back. and it was funny because his brother had the same thing, but it was not quite as severe. And so they had told him that they would never heal. So then, you know, he had not gone to the NFL yet, but the other one was younger and it was much more severe and more fractures and different stuff in his spine going on. And so, of course, like, he came to me because his brother had, and it was funny because he would be like, Jenny, these are not going to heal. And he was young, and I was like, yeah, they are. And he said, the doctor said they won't heal. I was like, yeah, they will. So I remember when his brother, like, had gone to the combine, and we were like, he hadn't had any x-rays for years, you know. And so I was like, I wonder if they're going to be on there. And they weren't. And I remember being like, call your brother right now and tell him that, like, they heal. They're not there. And so, but he was super young. So that was such a good, like, it's such a good moment to be like, okay, that does heal.
This works.
I'm trying to trust my process, and I trust them with their bodies too. You know, it's very much like collaborative, and I know they know their bodies really well because I've trained them a long time. So, you know, I think that they, in particular, they believe they can heal, and so they do.
We're talking a lot about athletes and sport and these different sports and the common threads. But I know, at least maybe not for you because you're sought after much more than maybe some of the new instructors that you have with you working in the studio. But this isn't just for athletes, right? I know several people that come there, and they're just everyday people,
Just
and
like me.
they're in
I mean, really,
they're in their 60s,
work out, yeah.
60s, 70s, and they will not miss their workout because they know I feel better at 76 because I do this once or twice a week, and they will not miss. And they almost panic if they go out of town because they attribute their health and how they feel about themselves and how they feel in the morning in their body to buying into Pilates and doing it and buying into the other stuff. Let's talk, because if no one knows anything about Pilates, and I'm going to butcher this, but I'm going to describe it anyway. Mat Pilates on the ground, very simple stuff. You've got the Cadillac, you've got the Reformer, these are apparatuses that sit on the floor, and then there's what's the elephant? I don't even know what the hell.
You do the elephant on the chair. Come on, bro. Come on, bro.
Exercise. Probably done that a lot.
You've got the wall board. You've got all these different things. There's all kinds of crazy, like, medieval things hanging on.
Torture. It's a torture chamber. It's basically what you're describing.
Springs and straps
really
and that's not what it is. Anyway, there's all of that and all these different techniques. But beyond that, I've done sessions with you where we don't touch any of that stuff.
Yeah.
And talk about that a little bit, because I got a concussion. I hate to keep using personal experiences, but that's all I have to draw from.
Yeah.
I had a concussion, went over the bars. For the friends that are listening to this that saw that happen, you can make fun of me. It was terrible. I was an idiot. but I got a concussion, and I think that's when my vision started to actually fade. Now I wear glasses, but I came in and you did a bunch of other stuff. Talk about some of the other things that you do to go along with Pilates.
Okay. Well,
That's an open-ended thing.
I can kind of narrow it down a little bit, but it's definitely not for just like high-level athletes. And I think sometimes for me, the people that I work with that are not high-level athletes, or they just, they like to golf, or like me, I like to hike, I like to mountain bike. I don't want to do it competitively. I just do it for exercise and fitness, and I like to do a lot of different things. I work with a lot of people like that as well. I mean, so much of my studio are those people, and I've had people ask me, like, is it more rewarding to work with these athletes than us normal people?
Normal
because
mere mortals.
all I care is that we help people have better quality of life, right? So even if you love to golf recreationally with your friends, that's your social circle. That's where you go, that you travel to golf. Like, you don't want people to lose that. So I think that if you can get people in that maybe can't use all the apparatus and all the equipment, and I use a lot of things. I mean, just standing. I mean, the first thing I do a lot of times with people is just get them in the mirror and look at their posture. I mean, good posture with a neutral pelvis, shoulders where they need to be, head and neck where it needs to be, can get rid of a lot of pain. But then your fascial system needs to be what holds your body there. Sometimes we'll use glutes or quads to hold our body upright, and those muscles fatigue easily. They use glucose for energy, but our fascial system and our postural muscles use oxygen for energy. So if we can just correct posture we all struggle with posture because we sit a lot, we're on phones a lot, our lifestyle kind of is not great posture. And so if you can just get somebody in the mirror and have them do a lunge or their gait pattern, which is walking, or a squat, which is getting in and out of a chair. And I'm talking like a 20-year-old or an 80-year-old. It doesn't matter, and fix their posture. Well, you created some symmetry in the body already and some awareness of where their body is in space. And that alone is going to get rid of a lot of pain and, aching and a lot of like pulling on the neck or the knee or wherever they're getting it. It's just teaching people what good posture is. Because sometimes people will be like, oh, your shoulders are so rounded, and people will pull their shoulders back, but their pelvis is still under. So then that creates more force in the back or the sacrum or those SI joints you hear people talk about a lot, having pain back there. So anybody we get in to the studio is always like, look at their posture first. And actually, I like to look at it upright is how's it interacting with gravity, right? How's their body responding to their environment? If you sit at a desk all day, if you stand all day, if you do sprinkler systems all day, that's what's shaping your body. Even if you came to me 5 or 10 hours a week, that's not enough. But if they're mindful of their posture in their job, in their everyday life, that's what shapes their body. How are they going up and down stairs? Like, can they even balance on one leg? Because if you can't have a normal gait pattern. And as much as we want to, we can talk about these high-level athletes, but surprisingly enough, those things are very difficult for them too. So sometimes we pull it back, and then that's probably kind of what you were talking about, being humbling. It's like you're trying to stand on one leg, maybe on a wobbly cushion, and you're like, why can't I do this, but I can ride my bike 100 miles and win at criteriums, not. But you can always be better. I would say you can, you've gotten to this level and you're good, but you can be better, stronger, faster, better, smarter,
Is it fascinating when you see someone walk towards you, and then you spend 2 minutes talking to them about what their career is or what their sport is, and you already knew before they told you? Because I feel like that is a skill that you've learned over a couple of decades of being involved with this.
For sure. I mean, you get intuitive about it, right? Like, I think that everybody has, like, with their job, whatever it is. I mean, Steve, you've done what you've done for so long. You have a real sense of, like, kind of how things are going to unfold, how to work with the title company or the whatever it is, you really get a sense or an intuition. And you might have felt like that when you were like Seth's age, but there's also like that intuitive sense that you develop that skill set. So you're probably good at it when you started in it, and you're probably good at it when you start in your job. But then you really start to like train or develop your skill set of intuition. Or for me, I do, a lot of energy work. And even though that was something really natural for me to feel in my 20s and do body work like that,
I have worked hard to develop that skill set. So people sometimes will say like, oh no, that's a gift, or that's the witchcraft, or that's the, but I've had to develop that skill set too, because while it's something that's intuitive for us, you know, you do have to like put effort into it and develop the skill set to feel it.
And then the data set that goes along with it, because you've seen so many clients,
Right.
you start to put these data sets together and you can
That's
see
all it
that,
is.
oh, if he's walking towards me this way and his gait is as such and his posture is such, he's probably this type of athlete.
And this is probably hurting him.
He probably does.
Probably.
Yeah. He do sprinkler systems, or he sits at a desk all day, or, you know, whatever. He's in construction and whatever it is, you can probably already be like, well, it's one of those three things, because I can see how.
I've heard stories. I swear Brianne told me one time she came into the studio and you asked her, like, how long's your hip been hurting or something?
Yeah.
And she didn't even say anything to you.
That's happened to me.
Yeah.
She's done that to me.
You just know, which is so crazy.
So intuitive for me, for sure. And I think that, I don't know if this is true, but I feel like it's probably with somebody that's like, you know, I always say like mastery of anything is full embodiment. So like I embody, like I always kind of joke when I have like, let's say Seth comes in and I'm working with him, I'm in Seth land. Like I'm attuned to him, like kind of get into that frequency of where he's at. And then that's how I can help him. And then if Steve comes in right after, a lot of times I'll like go out and like, just take a second so I can get into Steve land. So I can not take like whatever energetic exchange we've had through, whether it's on the reformer, or whether it's looking at posture or whatever it is, like then I want to be in Steve land so that I can kind of really connect with you and what you need me to say. But in doing that, and I think developing that skill set, I can almost like feel their hip discomfort.
So
kind of get a sense.
It's interesting you bring that up, because I actually didn't even have this in my brain to talk about, but now that you brought that up, I want to touch on it. You talk a lot about energy and how we're going to hippie land now. So
That's my
how we'll go there. It's interesting how trauma is stored in the body, stress is stored in the body. I've heard you talk about when you're specifically like trying to release someone's psoas, is that what it's called? But just other stuff, almost feeling, again, this is hippie land, so if you're listening, don't call me crazy. You almost like take on their emotions as they're releasing it out of their body, and you can explain that way better than I can. Am I understanding that correct? Like,
yeah, I mean, I can release a lot in their nervous system. Like, definitely, there are areas of the body that hold a lot more energy than others, psoas being one of them, because it really kind of has our fight or flight muscle, and it's the only muscle that attaches our upper chain to our lower chain. So really, if you go back hundreds of years, if we were being chased by a tiger, that muscle is going to kick in. If we wait for the central nervous system to tell us to use that muscle, then the tiger is going to have already gotten us. So that muscle in particular, that's why I do a lot with the psoas, especially with, in our high stress environment. If I can down regulate somebody's body and their nervous system by just gently releasing the psoas, well, then I know I've gotten their body into a state that it can heal easier. So then the rest of the time I spend with them, that hour or whatever it is, I know that I can get their body to move a lot better. So, and that's, one, it kind of has its own nervous system, so to speak, that really stays in a pretty heightened or bracing state, because our bodies don't know the difference if we have high level stress, whether it's playing football on Sunday every day, or just being a mom, or going to work every day and it's really high stress. Our body doesn't really know the difference. It just knows it has to be in a state of bracing for survival.
Yeah.
So to go to the very basic, like definitely not hippie land. I used to joke, and some of the players I've been with for a long time, I used to be like, do you want physiology, Jenny? Or do you want woo-woo, Jenny? Like,
yeah.
And some of me like,
I didn't know we had a choice.
Yeah. I probably never gave you a choice, and sometimes I don't do that to people, and sometimes I do. But especially as they get higher level, I find that I have to integrate that more. But, there's a lot around, meridians. I do like meridian flushes and acupressure.
Well, I don't know what that is.
So meridians in the body, it's a type of Chinese medicine, I guess, so to speak, and it's, thousands of years old. And so they figured out energetic lines in the body. I mean, it's really quite fascinating to not get into the history of it, but it's fascinating if you look at different lines in the body, the energetic lines, where there's, you can measure the electromagnetic field of those energy lines. But if you really want somebody that is like more physiology, which is my, my background at university, it's a lot of those meridians run along the main nerves in our body. So the sciatica, the obturator nerve bundle, the femoral nerve, some of the nerves that break off of the brachial plexus up around the shoulder and upper back. But I don't know how the Chinese came up with those energy lines before they knew the physiology.
Yeah.
But those big nerves in the body that generate a lot of electrical impulses, you'll see a lot of what we call meridians run along those same lines because they're high energy and we're just energy, right, in our body. So you can look at it from a physiological standpoint, or if you want to go over on the Eastern medicine side for more of the meridians and acupressure and acupuncture and, chakras and the whole thing. Either way, like, because, some people don't want to believe in those things, which is fine with me. You don't need to. You can look over here at the physiological side of it too. I've just kind of integrated both with like my training over the years. So, but then it's just, you can go layers deeper. And so like, that's why, especially in this culture, right? It's like hippie land, or I used to call it woo-woo, and now I don't even want to call it.
Yeah.
It's just real energy.
I think people are like becoming more awakened to that
I
too.
think so too. Yeah.
Like-
It's just real. Like, it's not, and I think that, a lot of sports culture doesn't encourage that. But I think when they, at least in my situation where people come to me and I do, let's say I have one player in particular, he's very sensory. And so to dig in his body and do like kind of a lot of that like musculoskeletal work, or, get rid of adhesion, sometimes his body just pushes me back. So I'll just do it a lot gentler and run down meridian lines and then go back to the muscle and it's fully released.
Wow.
So then it works. That's all I care. I just want it to work. And there's nothing like, energy. I don't have the lights off and all the I would though. But it's you guys have seen the studio. It's very like they come in, we kind of whatever I have to do. But sometimes people respond better if I just run down these energy lines where the muscles are kind of like congested or gummed up, or there's cerebral fluid, kind of not flushing through the spinal column very well. So you can do it more with meridians or energy lines rather than just look at the musculoskeletal. So as long as they really, and then they're like, wait a second, what is this? Because different.
It's unfamiliar, yeah.
But it works, right? And they're playing football better. They're playing their sport better. They're, going out on walks and feeling better. And, that's really what matters. And then I don't want to say they start to believe it because they didn't not believe it. They just know they feel better. So
Yeah.
You talk a lot about energy, and you have since I met you, and that's, I think, through osmosis, those who train with you and those who instruct underneath you or your studio, they come away understanding kind of what that means more in depth. Did you learn that? Have you always been that way? Like from your journey, because I think this is important. Let's talk about your journey from youth through college. And I don't want to dwell on this a ton, but I think it's relevant. You through college, I know that you were involved actually in real estate for a time until you opened the Intermountain Pilates, which 2007, 2008?
2008, yeah.
Okay, which is your studio here in Salt Lake. But the energy piece, have you always been that way, or is that something that you learned or that you thought, hey, there's value in this is real, and then you kind of went more into that?
Well, I think this is going to open up. This is probably vulnerable too, because I did grow up in Utah and not a part of the Mormon culture. So when I was young, I always felt like I could like connect with people's energy. So I had a couple of really good friends, you guys know, Becky, and then the man that I was married to, and I'd be like, hey, just like, I want you to like touch my fingertips because I could like feel that energy, and then I'd be like, okay, now I'm going to take that away and then do it again. And they'd be like, So I always knew, but so then it made me feel like I was kind of weird. But I really do now. I think we all have that. Like we all have the ability to sense, when we get in a room with somebody, we're like, ooh, that was like heavier, so that I think I just felt that way. And so in my 20s, early 20s, I really kind of tapped into that a little bit. I had a couple mentors that did a lot of training with like energy lines and a lot of like body work. And I had gone to like a workshop that was just with this lady, and she was teaching about like energy work in the body and balancing out like chakras. And so it was so interesting to me. And I remember her saying to me, like, you should come do my training. And so I feel like I kind of lucked out because there were only 3 of us in it. And she ended up being somebody that really mentored me through, like developing that skill,
because I do think like maybe it's a thing that I had, but it's also, you have to develop any skill set, right? Like even if you're a natural athlete, you develop your skill set in your sport. So definitely like the energy part of it, I always felt like was a really important part with connecting with people. I think for a long time, it made me feel really different, but now I feel like I'm able to utilize it and use language around it that is really quite, like more, like Seth said, more accepted. And it's just how our bodies are made up. And so in my 20s, I really did a lot of meridian work and with people. And now I actually don't even put it on my bio, because I'm more selective about when I do it and who I do it with, because the attunement part where I have to like attune to somebody can take a lot of energy.
From you.
Mm-hmm.
Okay.
But if I'm doing it correctly, like I really am just kind of a vessel for it. So like if I'm releasing somebody's psoas and I'm kind of getting myself clear, I'm really just kind of like a vessel for that, like release, and then I don't really absorb any of that. In fact, sometimes it's like healing on both sides, but if I remember I was going through something really difficult when I was like 27 or 28 years old, and I had to I just stopped doing it because I just couldn't clear my energy, and I didn't want to have an energy that I said to somebody else, and let's say I was working on Seth or you, that I wouldn't want you to absorb that because I hadn't cleared it for me. So
it was a burden for you, and you felt like you may even transfer that to someone, or you couldn't handle someone else's.
Yeah. So when I was young, so I hadn't quite, developed the skill set, I guess. And so I've, 27, 28, and then I actually stopped doing it for quite some time. And I think on some level, I just did it with my language and just being with people and kind of attuning to people. And then it was actually when I probably was, it was probably like 5 or 6 years later, and I was in a different, I was older and different space. And so now I don't advertise it because I want to be able to because I can be selective about who I do it with. But most of the people that are coming into my studio kind of have, they come to my studio for a reason, right? There's a culture there, a community there. And so it's really easy for me to attune to them. But occasionally I'll get people in there, and I don't want to offer that service. So I don't put that in my bio or something that you can come in and do. I want to be pretty selective about it.
It's a lot more intimate.
Yeah. To protect my own energy and to protect what I do, because I work a lot. So, but now it's really so, I'm much older and developed that skill set. So it's really pretty easy for me to not absorb it or have anything that I'm going through, onto somebody else. I just wouldn't do that.
Well, I think if I can give a shout out, if that's what we want to call it, the feeling and the atmosphere at your studio is so amazing.
Thank you.
It's got this, it's very positive. Everything feels good. Being around you, you can't not be around you and come away inspired. And maybe you feel like on E when you're done with someone like me.
I really
Do you know what I mean?
Mm-hmm.
But what you just talked about for the last 10 minutes or so is so fascinating, and a whole other piece of what you do. I think that when we talk about physical therapy, and I'm not down on physical therapists or anything like that, but what you do encompasses 3 or 4 or 5 different walks of rehab and health and wellness all into one. And you share that with the people who see you. You share that with the I don't know if you call them students, but the ladies who train at your studio.
Yeah.
And it's amazing. I don't know that there's another studio like yours around that does it. And this is going to sound terrible. I don't mean it to sound this way. It's not about money. You guys need to make a living, and this is your career, and you're very good at it. But it never feels like you're a paycheck, and that's a very rare thing, when someone's paying for a service. But it's crazy. Can you talk about? We could do this for another hour, honestly.
And I love it.
Can we talk about it's Stop Pilates, which is Merrithew, correct?
Yeah.
We touched on this earlier, but the different types of purely Pilates.
Yeah.
How many different types are there out there?
There's so many. And there's
a dozen? Is there 20?
There are some brands that are your biggest brands. You'll hear about Stop Pilates, Balance Body,
like Bossy is another bigger brand, but those are kind of like, there's some top, more international brands that offer a lot of education, different curriculum, all over the world. And then, I mean, really, truly, some people just start their own and be like, I'm Jenny Carr brand, which I mean, you guys know because of Talia, but at the studio, when I train my instructors, I obviously do a lot of education for Marathon and Stop Pilates and all of their brands, and I'm a presenter for them. But I also, with my teachers, to create the space that I have and make it unique so it's not like every other studio, I train them, all of my teachers and staff meeting, everything is like sports performance, neuro stuff, like how to posture stuff. And that's probably more like the Jenny method, so we kind of integrate it all together. But you could really find, I mean, I don't even know, thousands of people who are like, I'm going to be Seth certified, but for me, and obviously as being a licensed training center, it's for Marathon in Utah, I really, I always explain to people, it's helpful if you have a certification that's recognized nationally or internationally, because if me, Jenny Carr, decides to close my business and you have Jenny Carr certification, and you want to go get hired at another studio, they generally will want you to get another training or another certification. So I always tell people, and Chris Brown that works, does all the education, is excellent at this, but she, we try to explain to people, like, whatever you choose, whether it's us or not us, choose a certification that if you move out of state, if you move even better out of the country, just get your certification so it's recognized,
So it has some validity.
Because now, and I mean, this is like, in social media, so we have a lot of access to a lot of training just online, which is actually awesome and should be utilized. But if you really want to make it your career, like having something that like is internationally recognized, or at least nationally recognized, is good, because as you progress through your career, as like the older you get, you can move from one state to the next state to the next state. I mean, I have students come here all the time that did their training in Seattle or Japan, and they come here and test out at my training center, because we all are teaching the same thing, the same curriculum, which is Stop Pilates, and then they can test out with me, and then they can move to New Zealand if they want, and there are studios there. We really have a network that we can kind of connect people. So, and we are all very connected, which is why I do all those workshops that I present, like on Zoom now, post-COVID, but used to travel to present more. And so and everybody in those workshops are from all over the world. And so we really kind of get to know each other and, all over the world. And if we have people coming from, if I have somebody from Seattle or somebody coming from like Germany, like I had a gal, that came and trained from the Czech Republic, and she had heard about my training center and me from a volleyball player over there or something, so we really are connected, and we can kind of send people to people that we know have been like highly trained.
Yeah.
So that's helpful. Not to say that like, somebody's own certification isn't, but we just don't know as much about it, so we don't want to send clients that we care deeply for, or made a lot of progress, to somebody that we don't know what their training is or what their certification is, because we don't know, how knowledgeable they are.
You do a lot of trainings right here and certify people right here in your studio.
Yeah.
You just had a gal that just came home from an LDS mission that I think came in.
Right.
And that is intrigued by Pilates, and it's so crazy. We've talked about a lot of things that I didn't know that we would necessarily talk about.
Same.
So we've done this we had a gentleman on last week that is a personal trainer and comes from, I think I mentioned this to you offline, but if you, and this is Seth's question that I'm stealing, but what should someone that maybe doesn't have access to Pilates or an instructor or can't afford, right, to come in and do this, what should they be doing on their own? I know you mentioned like with the bands and stretching and things like that, but what can they do to maybe tap into this? Because we do have the internet now, right? What can they do to tap into some of the things that we talked about today without maybe going and paying to have instruction? What can they do at home?
Well, I think, it's great because we have so much access to YouTube, Instagram, and like so many things that we can do. And I always say find instructors that on those sites that you really connect with, or things they say resonate with you or really feel good in your body. And
do some of their videos, go invest in like a $7 flex band or a stability ball that's $15 and really find those videos and those people online or on Instagram or whatever your social media choice is, and do some of their 10-minute, instructional videos or whatever they are. But I always say, like, I think sometimes people will see an instructor and maybe they are really popular on Instagram, but everything they do doesn't feel good for their body. And movement should feel good, and it should feel like it resonates with you. So if you can find those teachers on Instagram, because you don't have access to pay for us, to go to a studio, or, you're more remote where there are no studios, you have the internet, and find, research some of those popular instructors, or reach out to a Pilates studio that, if somebody called Chris, she would definitely say, you're our favorite instructors on Pilates Anytime or Marathon Connect, or, and check those out so that they can do some stuff on Zoom.
And I know it's kind of, sorry to cut you off, I know that's kind of the budget route, but frankly, some people don't, or they're not going to have access, right?
Yeah. Oh, yeah.
And they're not going to get the one-on-one instruction of, hey, here's the diagnosis of what's going on with your body, and these are the things. I know if someone only came in 2 or 3 times, they may learn how to do a specific movement that they could do at home.
Absolutely.
Or at work, or at their desk, or at night before they go to bed. And I would recommend that. Hey, if you can't afford to and don't have access consistently, that's okay. I think you should still see someone such as yourself or one of your instructors to kind of learn the minor things that you can do at home.
Yeah.
Because every time I do a workout with you, you're like, you're doing it wrong.
No, I don't.
You're doing I see that. But I never do it right to start with. And then we kind of tweak some things, and I'm like, oh, now I can feel that burn in my hip. And then, after a couple of sessions that way, I know that that's where the issue is, or that's what's slowly getting better. And that's why I needed to do it in a specific fashion, right? And I learned a lot just our first handful of sessions.
Right. And I always joke that, like, I would love to have people, like, I walk around with people and be in their pocket, but I can't. So if you could invest, even if it was a few $100s, and you invested in like 1 to 3 one-on-one sessions with somebody. I'm an educator, so I think that when I teach people, generally I do it, they're moving and working, but I'm also educating them on why I'm doing what I'm doing, so it makes sense. And so, like, for you, that, you come in and I tell you you're doing it wrong, which I don't. But, but what I do know is I can't just tell you, this is why you're hurting, or this is why you're doing it wrong, so to speak. What I have to do is teach you how to do it right. And then the minute you feel it in the right place, you're like, oh yeah, this is the right way.
Exactly.
Like, you're like, okay, I could see how that was like bugging my knee or my hip. And then I teach you why, like why maybe this muscle wasn't supporting you here, and why. And then you're going to go home or anywhere. You're going to go work out at the gym. You're going to get on your bike. You're going to be thinking about, I think we did some stuff with your thoracic, and like you were thinking about it on your bike. So then you're doing, like, say, Pilates or postural stuff on your bike. So that one session, let's say maybe it was $100, $200, I don't know, like everybody charged something different, but you just translated everything you learned in that hour onto your bike at your job, how you're holding your upper spine. So you're basically like doing it all day. And so there's got to be that place that resonates with you, even if you come in and you're like, it's humbling, I've been doing it incorrectly, but I always have to make sure you feel it correctly, or there's no motivation to keep doing it. So once you feel it, you're like, oh, I haven't felt that muscle, that feels different. And you start doing it on your bike and you're like, wait a minute, that feels better. And then you sit at your desk and you stop doing what you were doing and you're like, okay, my back's actually feeling better because I'm doing that one thing or those 2 things. So if you get 2 or 3 of those sessions and you make an investment in yourself to do that, but then you're like, I can't afford it, or I have to, like do some of it online, maybe once a month or every 3 months, invest in a one-on-one session. Like if you're with a teacher that resonates with you and they educate you on what they're doing and why. And that's the goal, right? Is that I always say I want everybody to come back to me, but I really want you guys to leave and be able to take care of your own bodies. And, people sometimes I think have a fear of like, well, if I teach them, they'll go away. But I've been doing this for 20 years and that's never been the case. I educate and teach people as much as I can. So if I never see them again, I've somehow improved their quality of life and their physical body. And I, because I get
students, and they become pro athletes and they go overseas, and I won't see them for 6 months, and I want them to stay healthy with or without me. So if you find a teacher that you can go see, like you said, one-on-one, or even just, a couple times, and then you can do a lot of your other stuff, your lifting, you do some online classes, so it's less expensive and you don't have to go anywhere. It's worth everything.
I have a balance board at my desk upstairs because of you.
Really?
Because my ankles are so weak and so throttled. Jenny, you are an amazing person.
Thank you.
Thank you so much for spending time with us. If people want to get a hold of you, I know you're not huge on social media, but what's the best way to get a hold of you or get in touch with your studio?
So my studio name is Intermountain Pilates Training Center, and you can look it up online. It's iptconline.com.
IPTC?
So it's the first letter of all of Intermountain Pilates Training Center.
Okay.
So you can look that up. We're an education center, so we certify instructors, and then we also have, group classes and sports performance. We do, so many things. And then on our website is a phone number that they can call or text, and that's where they usually get Chris Brown, or, it's a real person. They'll actually text back. And as you know, we have several instructors that we can put people with, and we have group classes. We usually have people do at least 1 to 3 private sessions, one-on-one, so that they know how to change equipment, kind of learn about their body and their posture before they go into group classes. And we have only 8 people in group classes, so they're fairly small. And, we can pay attention to that kind of stuff, but they can call and they can set, whatever their schedule is. We have a teacher that it can accommodate, mornings, afternoons, evenings, whatever, weekends, we can put them with those instructors. And then they have options with group classes to come and take, with whatever their schedule allows. So, and then we do obviously a lot of sports performance, a lot of rehabilitation, with injuries and things like that. Not just sports injuries, but injuries in general. So, we love to work with. We get a lot of that too. So
2 things. You should write a book. 1.
you can help me do that, Steve.
I would read it. We can do that. And then number 2, I really hope you'll come back
I'd love to.
and do this with us again down the road, because I could spend hours talking with you, and there's so many avenues that we didn't go down. But we thank you for your time.
You're welcome.
Thank you so much.
Guys, thank you so much.
Thanks.
You guys are my favorite. Thank you.